October is Breast Cancer Awareness Month, and it's being marked in countries around the world. Medical experts and activists say it is a time to help increase attention and support for the awareness, early detection and treatment, as well as palliative care of this disease. Breast cancer is by far the most common cancer in women worldwide, both in the developed and developing countries. The International Agency for Research on Cancer says there are about 1.38 million new cases and 458,000 deaths from breast cancer worldwide each year. At least 80% of people survive breast cancer in North America. However, less than 40% survive the disease in low-income countries. Joining us for more on this subject is Dr. Paul Dsane-Aidoo, Head of Clinical Services at Kasoa Polyclinic in Ghana and a board member of Ghana Medical Journalism Association. Dr. Dsane-Aidoo, welcome to the show.
Thank you very much.
So less than 40% of women survive breast cancer in low-income countries, Absolutely. Which of course include countries in sub-Saharan Africa. Yes. Tell us about some of the reasons.
Okay, so as WHO has rightly said, almost about 500,000 die from breast cancer every year, and out of this, about half are from sub-Saharan Africa and low-income countries. In Africa, one of the big things is late presentation. In fact, breast cancer is curable if it is picked up early enough, and our biggest challenge in Africa has been late presentation. This has been due to, first of all, the trust that people have in traditional healers. These are people who have gained the trust of patients, and when they have any kind of medical condition, they tend to resort to them first. Unfortunately, they end up spending so much time with them, and then by the time they present to the hospitals, it's really very late. Another issue is the religious healers. I mean, pastors, imams, traditional religious leaders have earned so much trust, and they end up also taking so much time of patients who have breast cancer. But the big one in Africa, again, is the customs. Okay. You know, we are in a very patriarchal setup, and also has a very polygamous setting. Most women with issues of affecting their sexuality and even their breasts would want to keep it quiet. And
because of stigma, perhaps, at some point, right? Stigma has a lot to do with it.
There's a bit of stigma. There's a bit of stigma as well with it. And so if she comes up publicly, people are going to probably think that she's done something evil and she's being punished for it. You know.
Sometimes husbands also kick their wives out from the house.
And so if she's competing with another woman with her husband, then she'll keep hiding it because she wouldn't want to show her deficiency to the husband or to the public, so that she's kicked out of the house. And so this poor woman will just keep to herself, and before she presents to the hospital, things are really late already.
So let's look at solutions here. We talked about husbands. How can husbands and men in general be part of the solution?
In fact, one of my greatest heroes of breast cancer was this man whose wife had suffered from breast cancer, and he had been with her for over 10 years, until one day when she finally ceases breathing at home, and he brings her himself to the hospital after 10 years of taking care of the wife. And so I think men play an immense role to prolonging the lives of people battling with breast cancer. And this woman has survived almost 10 years with breast cancer because of the support she has.
Very important.
Yes.
And what is the message that we can share with women that do not have the resources, even for prevention or screening, or when they are diagnosed with breast cancer? What is the message there?
Okay, so the fact that you are diagnosed with breast cancer doesn't mean it's a death sentence. That's first of all. But even before you are diagnosed, every woman should learn how to examine her breasts. That is key, at least to pick up breast lumps, to observe if there's any bleeding from the breast, or any nipple or ulcers, discharges. You have to report early. But if you have been diagnosed, it's not the end of the world. You need to talk to your doctor to see what next is for you in terms of the treatment, and I think that's basically what every woman needs to be able to do. But solution, as you mentioned, number one, health literacy, educating our women, educating our communities on what to know about breast cancer. Again, follow-ups have been a big thing in Africa, and I think that some people have pioneered breast clinics, which is very commendable. That makes it a bit comfortable for women to come in and report their issues of breast problems. And so a few women, especially in Ghana, someone like Dr. Wiafi, she's done a fantastic job having a clinic where women can easily come in and talk about issues affecting their breasts and these problems. And this helps with follow-ups, early diagnosis, and treatment.
Thank you, Dr. Dsane-Aidoo.
Thank you very much, Linord.
Thank you. And that was Dr. Paul Dsane-Aidoo. He is Head of Clinical Services at Kasoa Polyclinic in Ghana.